Hi, my name is Heather Hunt. I'm a chiropractor and cranial sacral therapist, and I also practice functional medicine here in our little town of Nevada City, California. And with me today is Janelle, and I'm going to have you introduce yourself.
Thank you. I'm Dr. Janell Jones. I am the owner and pharmacist at Gold Country Compounding Pharmacy, just down the road in Auburn, California.
Great. So we're representing two women-owned, women-run companies,
Yeah.
businesses, which I love. And today I'm going to pick your brain about bioidentical hormone replacement.
Sounds like fun.
Being 46 myself,
Mhm.
and being a just general dork and measuring my hormones since my mid-20s. It's been in my sphere for a long time, and I, come from a background of feeling like my body should be able to do everything itself all the time. And my 40s have humbled me quite a bit, as did having 3 children.
Right.
So I've done personally some different pulses of bioidentical hormones throughout my life, but most recently sticking on them quite a bit longer.
Yeah.
And when I found and trying, multiple companies, and then when I tried yours last year, I was like, oh my gosh.
Big difference, huh?
Big difference. I don't know what magic you have at your lab, but I've been there and it feels really good. So,
Thank you.
but the quality of your products and everything have been really transformative for me. So thank you.
You're welcome.
So I just wanted to start out with, if you could explain what bioidentical hormone therapy or replacement is.
Yeah, definitely. So when we're talking about bioidentical hormones, that really trickulates down to just one fact. The hormones that I compound with are chemically exactly the same as what your body should make itself.
Right.
And that can be very different than a lot of commercially available hormones that might work at the same hormone receptors, but they're different enough that they can cause issues, side effects, and bigger problems down the road.
Right.
So we're going to stick with the things that are as close, well, exactly the same as what you can make, and not something made by a horse.
Right. So how I explain it, and I'm hoping you can tell me if this is right, is that the bioidenticals are, like you just said, exactly what our body makes. So we only have to use very small amounts to just augment our system and remind our bodies what they need to be doing, or ultimately postmenopausally replacing.
Yes.
But because they are identical, we don't need these large amounts.
You don't need large amounts, and you don't have all of the side effects that you can get from something that's close but not quite.
Right.
So it's a much more natural and safer and more healthy approach to supplementing your own hormones.
Okay. And then the second thing I say is that synthetic hormones are given at larger doses. And since our body doesn't recognize them, they sort of take over and suppress our natural system.
That's true.
And replace it with pregnant mare urine.
But exactly,
like
exactly.
birth control.
Yeah.
That it just sort of shuts our system off.
Yeah, it overrides everything that your body should be doing naturally.
Yeah.
And we want to work with it and not override it. Because if something is doing all the work for our bodies tend to sit back, relax, and stop doing what they're supposed to be. So
yeah.
It's more of an encouraging and getting on the right path without, I'm going to take this and that's all it's going to matter.
Right. Yeah. And there's a place for everything, and synthetic hormone replacement, birth control, all of those things have an important place in our health and in our bodies.
Sure.
But I personally resonate strongly with using the small doses and just sort of augmenting, especially if you have a generally healthy system.
Yes.
Right. So focusing on that general health, it can be a real tool in my experience.
I completely agree.
So how do you know if you need hormone replacement?
So there's 2 main things that we look at. One, lab work. Either a blood or saliva test. If it's showing that you're abnormally low on hormones, sometimes women won't even notice. Right. But they can be very extremely low on certain hormones, and that test is the first indicator that it's something to look into. More importantly to me is how a woman or man is feeling. There are a lot of things that can come from having hormone levels that are out of balance or too low. And it really affects overall quality of life.
Yeah.
More than just what what we tend to see most often when we're talking about hormones is either birth control or menopausal symptoms.
Right.
And their hormones role in the body is much, much bigger than just those two things.
Right. Right. Yeah. And so that was something for me postpartum with my third child. My hormones went really low and I used them for about 8 months and then my body reset and I was able to go off them again. So that was really neat for me. So there's a lot of misinformation around bioidentical hormones and even hormone replacement. And a lot of people think, oh, hormone replacement, stroke or breast cancer or something. Do you want to go into that?
That's a tough one. And I think there's some injustice on the studies of hormones. They need to be updated.
Yeah.
A lot of the information that we have that warns about increased risk of cancer was done on synthetic hormones,
Right.
Versus bioidentical hormones. I think we really need to get new and better information, and the information that we are coming up with now is actually showing that they're very beneficial,
Right.
very safe, and can be taken as long as a woman wants instead of for the shortest amount of time possible.
Right. And I think that's really important that people understand that when they hear about like the Women's Health Initiative or these different large studies that have been done, that they were done with completely different substances than what you and I are talking about.
Correct.
Yeah. So that's, Google it if you want to know more, but we're not we're talking about apples and oranges. Okay.
It's a good way of explaining it. Yeah.
We're not talking about the synthetic hormones that have been large scale studied. We're talking about these very specific compounded bioidenticals that are they only available through compounding pharmacies or
there are a couple of things that you can get at a regular pharmacy. Prometrium and progesterone capsules are bioidentical.
Okay.
They are made with peanut oil, so it needs to be avoided with anyone with a peanut allergy. There are some topical estrogen or estradiol patches that are also available. Those can be rather high dose and need to be used carefully.
Right.
But those are very effective and bioidentical as well.
And then what about the progesterone you can get over the counter?
So there are some progesterone supplements that are available over the counter. Sometimes they are not bioidentical and the packaging can be a little misleading. Sometimes they are bioidentical, but at a dose that's low enough that it might not be effective. Okay.
And then finally, testosterone.
Testosterone you can get bioidentical in many, many different forms for men. They tend to leave us poor women out, and we still need testosterone.
Yeah. So the main hormones we've already just been talking about them that we tend to replace are the 3 forms of estrogen. Well, we don't. This E2, E3.
Yeah. Estradiol and estriol.
Right. And progesterone.
Yeah.
And the testosterone.
Yeah.
And speak a little bit of why testosterone would be so important for women.
Women, not just men.
Not just men.
I call it the teenage boy effect.
Yes.
It's everything uplifting and energizing. So it increases a sense of well-being, energy levels, sex drive, all of those teenage boy, I can take over the world kind of feelings.
Oh my gosh, I have a teenager right now. Hopefully without the I know everything,
right?
What we call the teenage rants.
Yeah.
And also I think about testosterone as being not only sex drive, but just drive and motivation in general. Yeah. And so, and then they are those anabolic steroid hormones. So it's building.
Yes.
So I think of muscles and everything that we're trying to build in our bodies. And then the estrogens. So the estradiol E2.
Yeah, that's the power horse. That's the strong one that causes a lot of the main physiological estrogens. So
I think of it
Another
like the
analogy,
sexy.
right? Yes, it's the strong, potent, feminine power to us.
Yeah.
And then I like to think of it, another analogy that I love is your estrogen is the gas pedal in your car. It's the driving force. It's the things that gets done. It uplifts and motivates. Whereas your progesterone is the brake.
Right.
Slows things down, keeps things balanced, helps with sleep.
Anxiety.
Mhm.
Yeah.
So you need both to drive a car. So it has to be a fine balance between the two.
Okay. And let's talk about different ways people can take these bioidenticals.
Yeah, no, that's fine.
What forms?
Yeah, and that's where compounding comes in, and what makes it so much fun is at a regular pharmacy, you have like 3 or 4 choices of strength, maybe even less. Where at a compounding pharmacy, I'm gonna make a prescription just for you.
Right.
It's gonna be exactly what you need. It's gonna be the right ratio of estradiol to estradiol to estriol to progesterone to testosterone.
Yeah.
You might need 1, you might need 2, you might need all 4. And we can give those to you in different ways,
Right.
depending on your lifestyle and your preferences. So the most popular, I would say, at the compounding pharmacy is topical creams. They're just usually a very small amount of cream that's rubbed into the skin daily.
Yep.
And it's a great, effective way of delivering hormones.
Yeah, and the little clickers you make are great because you don't even have to touch them.
Yeah, so the clickers that she's referring to, there's a couple of different manufacturers, but it kind of looks like a deodorant applicator. You click the base and it gives you a measured amount of cream. And then you just use it to rub the cream in, and it's super clean and easy.
And then there's also sublingual, where
Yeah.
people put under their tongue.
It's typically called a troche, and it's like a little medium firm wax that dissolves in the mouth so that the hormones can absorb directly through the cheek,
Right.
straight in the bloodstream.
Because we don't want to swallow them, because then they have to go through the liver and the GI system.
Exactly, and that the vast majority of anything taken orally is broken down
Right.
by the stomach acid and the digestive tracts, and then first pass through the liver.
Can I put you on the spot a bit and just ask you, what do you find works better clinically? The creams, the troches, is it sort of dependent on the person?
It's kind of a combination.
Okay.
Let's say you need all 4.
Yeah.
My personal preference is to use the estrogens and the testosterone topically, go through the skin, gives it a slower release in the bloodstream, so it's a more steady state, which is great. I like to take progesterone orally, which is
In capsules, right?
in a capsule
Yeah.
form. The reason that I like progesterone orally is I'm actually using that first pass metabolism in the liver. When it breaks down the progesterone, it creates another chemical that is great for helping women sleep.
Right.
And I don't know a single woman out there that couldn't use some help getting a better night's sleep.
Right. And I've heard too, I mean, what I've read is that the capsules of progesterone are better for uterine health.
I agree with that. Yeah.
Okay.
Yeah. So that's my personal preference on
Yeah.
that one. There's a lot of like minute details that could change the way you use it and what would be best for a specific person, but vast majority, that's my preference.
Great. And then what about drops?
Not a big fan of drops.
Yeah.
It's very hard to get an accurate dose.
Yeah.
You're either using a syringe or a dropper that's not incredibly precise.
Yeah.
Doesn't stay in your mouth very long because you're going to be salivating.
Right.
So not my personal favorite, but some people really enjoy that.
Do well.
Yeah.
Okay.
Yeah.
And then what about like the pellets and things? Are those available in Bioidentical, or is that only?
Those are available. Bioidentical requires a very specialized sterile pharmacy. And then they're
It's like
injected under the skin with a very not something I do a lot of work with, but I do know a lot of patients that really enjoy them because there's no maintenance to it.
Great.
The pellet's implanted and they can go about until they need to have it replaced.
Yeah.
So convenient factor there.
Okay. And then there's these different punctuated times in life that we think about using bioidenticals, perimenopause, menopause, postmenopause. Any other times are you using them with teens at all? People for, I guess fertility could be.
Fertility, they're very commonly used to help maintain pregnancy, make sure progesterone levels are high enough to keep the baby. Progesterone can also be used by younger women to help reduce the severity and longevity of their menstrual cycles.
Right.
Really reduces PMS symptoms.
Right.
That can be very helpful.
Also help, I would think, prevent fibroids.
Yeah.
And
yeah, it can definitely help with those situations too. So
endometriosis, all that.
Yep.
I'm constantly amazed how many women come in for a functional medicine consult and they literally are having to take tons of ibuprofen.
Yeah.
Their periods last up to 7 days.
Or even significantly longer.
And I'm like, this is why men rule the world. But so progesterone at low doses for those people would be,
and it's usually taken cyclically.
Yeah.
Sometimes it's taken all month long, but it's lower dose days 1 through 14 of the cycle, and then a slightly higher dose days 14 through 28. And that can be super helpful.
Yeah. And is that something, I mean, actually I did that in my late teens, early 20s. My body sort of reset itself again after a few months of that. Do you find that, or do you find people's needs?
That can definitely happen. And then the other thing is most people wind up just using a commercially available birth control, because that is also going to mimic with the estrogen and synthetic progesterone to help do that same cycle.
Okay.
Just the bioidenticals, a little bit natural way of doing things.
Yeah. Yeah.
Depending on the person, it might be a better option for them.
Great. And then perimenopause. Tricky.
Definitely. And that's usually because the body is stuck in this kind of limbo where one day I'm going to make all the hormones that I need.
Right.
And you're feeling good. And then it's going, I can't do this anymore. And it stops.
Right.
And it winds up doing this yo-yo effect, which can cause all of the lovely, perimenopause symptoms, migraines, hot flashes, night sweats, problems, sleeping, fog, thinking, all of those not so fun things.
Right.
So usually at that period where you're not really quite to menopause, just even a really low dose estrogen progesterone can kind of give you this little stable baseline, so those fluctuations aren't so dramatic.
Right. And then with the fluctuations in general, I always have people read about these hormones and try to then figure out what's going on in their bodies depending on what they read, and like really becoming more familiar with the estrogens and the progesterone. Is that something you kind of help people pulse additional, like at different times in their cycles, or do you try to?
It's typically around perimenopause or menopause when your cycle is going to be going away.
Yeah.
I tend to find it's more about getting that normal, healthy baseline.
Okay.
Versus continuing to try to follow a cycle.
Yeah.
But that's not for everybody.
Okay.
Because yes, we can do something like we were talking about with the progesterone. If you still have most of a cycle and you're going up and down, we can kind of naturalize that rhythm still, your monthly cycle rhythm with some progesterone, so that the symptoms aren't so overwhelming.
Right. Right.
Yeah.
And then what's the goal with hormone? I mean, besides the stabilization, feeling better day to day, are we trying to like keep our periods longer? Are we trying to, the perimenopausal goals? I'm personally trying to prolong my menstrual cycle as long as possible, because these hormones are so protective and so important for our bodies. So one of my goals with bioidentical hormone replacement is to keep my cycle going longer. Is that something that
I think holding on to your hormones longer,
Okay.
whether it's a cycle or a baseline,
right?
That's the important part.
Okay. I like that reframing.
Hormones are incredibly important, and it's not just to the cycle.
Right.
And menopause, when we stop having a cycle, that's usually the indication that all of our hormone levels are going to just keep going down.
Right.
But we're living a lot longer than menopause now.
Yeah.
And hormones can really help us stay happy and healthy a lot longer than menopause.
Yeah. One fun fact I tell patients if they're feeling hesitant about trying bioidenticals is that the average age onset of menopause, 52, is the same as average onset of dementia for women, because these hormones, particularly estrogen, is so important for brain health.
Yes.
And progesterone, my understanding, is bones. Estrogen is also very cardiovascular.
Yeah.
What do you tell people about these hormones as far as longevity?
To look at newer studies.
Yeah.
There is so much interesting information coming out that's showing benefits that we really never considered before. Improving cognition, mental clarity, cardiac health, bone health, all of these things that are super essential for us.
Right.
Have been ignored for such a long time.
Yeah. And I think because I like to really reframe everything through the lens of vitality. And if you're thinking vitality, we want that stamina of the testosterone. We want that juicy yumminess of, you know, and the tissue health of estrogen and the calm sleep. Just, I love the word progesterone is progestation. And so I tell women, we're gestating you now.
Exactly. I'm stealing that. I'm stealing that. That's amazing because that's exactly what it is.
Right.
Yeah.
So that's great. And then menopause, it seems like an easier time to come in with these hormones. Is it best to timing wise start? Yeah.
When you feel like you need it.
Yeah, and testing, obviously. I mean,
testing, yes. But women know how they feel. Right. We know when something's not right. We know when things are slowing down. We know when we're ready to pull our hair out.
Right.
My best recommendation is listen to your body. Yeah. And don't be afraid to ask for help. Right.
And then what's again the longevity of?
So that's a fun one in the research too. So up until recently, the wisdom was the lowest dose of hormones possible to handle the symptoms that we're trying to treat for the shortest amount of time possible. Right. That's changed. Now we want to still keep those hormone levels as low as we can to get the effect that we're looking for. Okay. Keep going. Yeah. Well, feel as good as you can as long as you can. Keep that vitality.
Yeah. And because these are the bioidenticals and not the synthetics, the safety is a lot greater.
Yes.
I wanted to ask you about a few common symptoms that women have, and just like if you have any bullet point, like what you think, right?
Sure.
So breast tenderness before cycles.
Usually caused by changes in hormone levels. Not necessarily too much or too little, although it can be a side effect that's associated with estrogen levels that are too high. More than anything, it's being super sensitive to your natural cycles coming up and down.
Right. And that's the same with these migraines, right? Is what I've read is that estrogen, there's a thing called estrogen withdrawal syndrome, which is when your estrogen drops right before your cycle. Headaches tend to be triggered then, and then as it starts rising again, day 2 or so of your cycle.
Yeah. And you go away and you start feeling like a human.
So is that, I mean, that's a really good time for just doing that baseline of estrogen.
Yeah, getting that minimum level up high enough that it's not going to start triggering the headaches for you all the time.
Right. And then low enough that you're not getting that breast tenderness.
Exactly.
And okay, hot flashes.
Usually your estrogen and progesterone are too low. Estrogen can be the most effective in helping treating that, but you don't want to outpace your progesterone levels. So once again, going back to that car, gas and brake. You need to get that estrogen level high enough that you can stop the hot flashes, but not so far that you've outpaced your progesterone levels.
Got it. Night sweats.
Progesterone.
Okay, so the other thing I was reading about is how when estrogen decreases, your cortisol increases and anxiety goes up in perimenopause and postmenopause.
Yes, we love cortisol. Love it. You need it. Really need it too.
Need it good and
Yeah. A lot of times when we get to menopausal age, the belly fat and the bottom fat those start to creep up because your cortisol levels are going up too. It's really hard to lose that specific weight if cortisol and the anxiety that go with it are both elevated. So yeah, getting a healthy baseline of estrogen and progesterone makes a big difference there.
Okay. And then PMS, I remember in my late 30s. So what I've read is progesterone starts dropping about mid 30s and you don't notice any cycle changes or anything for quite a long time. But what I noticed in my late 30s is I was wanting to plan my month around when I wasn't going to be PMSy because it was becoming so intolerable. So progesterone at that point?
Yep. Usually, and traditionally when you're younger like that in your 30s or so, you don't really need to substitute your estrogen. It's more about evening out your estrogen with your progesterone.
Okay.
Yeah.
And then can we talk doses a little bit?
Sure.
What do you find would be like is kind of a typical perimenopausal dose?
Of
sliding
what?
scale
Of what?
Progesterone, estrogen,
all of them?
Let's say E2, estradiol, estriol.
Okay. Very hard to say.
I know.
Because everyone is so different. The way that their skin absorbs totally different.
Okay.
How much their body is already producing is different. What they need to get a specific effect is different. For estradiol, the super potent one, you can be all the way down to like 0.01 milligrams.
Wow.
Tiny little dose is effective for some people.
Okay.
On the very high side of that, I've seen someone need 1 to 2 milligrams of estradiol, which seems unbelievably high. But that's the dose that gets their blood work, their saliva test back in line of what their normal range should be.
Okay.
So huge scale difference there.
Right. And progesterone?
Progesterone, if it's taken orally, low side 25 milligrams. Most women take 100 to 200 milligrams at bedtime. That can go all the way up 600 milligrams.
Wow,
I've seen for some women become effective. Yeah.
And testosterone?
That can be very different too, but I would say in general, low moderate dose is about 1 milligram. Moderate dose is about 2 milligrams.
Got it.
Yeah. It's amazing how much 2 little milligrams can do for a woman.
I love it. I wish I would have been on some of this a lot longer.
Yeah.
You know, I think we set ourselves up for disadvantage when we think our body should be able to do it all, or there's something wrong that we need that extra help. So let's see, anything else you can think of? I have a zillion more questions, but I want to be concise.
More than anything is just, to me, it's super important that women look at the research out there because there still is so much misinformation about the safety.
Right.
And there's so much more that's available now.
Yes.
To really help understand that it can be used very safely long term to really improve their quality of life.
Right.
Well into your 80s and 90s.
Yeah.
Even longer.
Great. And so we do offer blood tests at our clinic. We have a cash lab that you can get estrogens, progesterone, testosterone for just about $100.
That's perfect.
And you don't even need to be a patient. I can't prescribe, but we do have another prescriber here, and you probably have resources that you can refer women to. The blood test available here and a clinician. They can also reach out to you at Gold Country Compounding. And you have
some referrals to some fabulous providers that are very well versed.
And work remotely as well?
Some work remotely, some are in office, a lot in our area, so there's a lot of options.
Great.
Yeah.
Well, thank you so much for coming.
Thank you. My pleasure.